Thank you again so much for taking your time out to support and for your interest in all that we're doing here. Thanks again to all the veterans, family members for your service, as this is joint service. I'm a veteran, but I know that my spouse put as much hard effort and time into those deployments as I did. So again, thank you all so much for coming to this plenary session. As you can see, we've got double the number of experts here up on the stage than you have in the program. So for that, what we're going to do is we're going to have this set up more like a conversational style. You've got 4 exceptional experts who are going to explain to you some of the latest and greatest in their fields, and then after that, we'll open it up to questions. That way, they might, already answer some of your questions when they go through their shtick. So without further ado, what I'll do, since we've added folks, Carl, actually, let's go ahead. I'll give the mic to Carl, let him introduce himself, pass the mic, and then ma'am, we'll start with you.
Aloha, everyone. My name is Carl Kiyokawa. I'm the Pacific Regional Director with TriWest Healthcare Alliance. We're the contract partners working to support the VA Pacific Island healthcare system in delivering healthcare needs to veterans not only in Hawaii, but also in Guam, Northern Mariana Islands, and American Samoa.
Aloha. I'm Jim Horton, the Director of the National Memorial Cemetery of the Pacific, more commonly referred to all of us as Punch Bowl. Thanks for having us up.
Aloha. I'm the Acting Director of the Veterans Benefits Administration Regional Office.
Aloha! All right, I'm Jennifer Gutowski. I'm the Director for VA Pacific Islands Healthcare System. Been here and honored to be the Director for 2 years now, with the VA for 20. Thank you.
Okay, we were all back, thank you so much. We were all back in the green room and we tried flipping a coin, and that would work if we had 2 people, but with 4 we had to arm wrestle, and Jennifer won, so she gets to go. She gets to go first. So if you would, ma'am, we know there's a tremendous amount going on out there at the VA. We've seen about the Mission Act. Would you mind taking some time to share with us what you've got?
Absolutely, Dr. Brown. Thank you so much for this opportunity to be able to share with all of you all of the wonderful things that the VA is doing at the national level. And then I'm going to bring it down local to what's happening here in Hawaii and the Pacific Islands. The VA overall, we have a table in the other room, and I just want to mention for those that may not be receiving their health care from the VA or benefits, there's this wonderful booklet that's called Hello, Welcome to VA, Let's Get Started. If you haven't seen this booklet, stop by our table, pick one up. If you don't need it, share it with a friend. It has some wonderful resources that leads people through the process of what they need to be prepared to bring to get benefits, to sign up for health care, to sign up for educational benefits. So this is really a wonderful booklet. All the numbers that you would need for VA are right here, and a wonderful tool. So please help me spread the word about the Welcome Kit. I'd like to cover a little bit about the Mission Act, because that's truly huge for VA and very transformational in what's happening. Now, the Mission Act stands for Maintaining Internal Systems and Strengthening Integrated Outside Networks. Got to have a good acronym. But there are over 50 elements to this law that have gone into effect, and many of them are still evolving in how those will unfold for our veterans. A couple that I will highlight today, one in particular, is care in the community and how that's changing. The Choice Program, as we knew it, has sunsetted effective June 5th. Now, all of our care in the community programs are under one umbrella. So what does that mean for our veterans here at Pacific Islands? Good news is the eligibility remains the same because we are a VA facility without our own VA full-service hospital. All of our veterans for VA Pacific Islands healthcare system are eligible for care in the community. So nothing has changed. What has changed is the partnership that we have with TriWest. And in the past, for the Choice Program, veterans had the opportunity to call TriWest directly for a choice appointment. Now, going forward, the VA is going to have more opportunity to do the care coordination. And we see this as a wonderful opportunity. We're going to have a chance to offer you care at the VA, and if we're not able to provide that, that's when we're going to turn things over to our partner at TriWest, who will be able to connect you with that appointment in the community. So that's one of the major differences, and we see this as a great thing moving forward. One of the other new benefits as part of the Mission Act is urgent care. Veterans now have an urgent care benefit. How do you know if you're eligible for that? If you've received care from the VA in the past 24 months, you are eligible for that urgent care benefit. How do you find a retailer that provides that service? There is a website, and on our table we have a nice overview of a pamphlet that shows you where to find that information. The list of providers is being expanded upon day by day, and I'm certain TriWest, Carl here will comment about that, but more and more urgent care locations are signing up. What's important for you to know when you do access that care is to be aware of your priority group, as well as be aware of how many times you use that benefit within a calendar year. I say that because there may be a co-payment of $30 associated with that, depending on your priority group, or as many times as you use it during the year. So that information is in the pamphlet that's at our booth, so please pick one up to learn more information about that urgent care benefit. Another big piece of the Mission Act is the Caregiver Support Program. And folks are asking, when is that going to be expanding to other veterans? To be honest with you, I don't have all those details yet. I'm still working on getting that information flowing from central office. But as soon as I know more information, I'll be sharing that with you. As far as I know, it'll be coming some point in phases during the next upcoming year. And again, more for follow on that. For those, just bringing it back to VA Pacific Islands healthcare system, for those, if I can see for show of hands, how many of you receive your healthcare from VA Pacific Islands? Wonderful. Well, thank you so much for choosing us. For those that may not be aware, we have part of VA Pacific Islands healthcare system. We have 11 sites of care throughout the Pacific. So we have a presence on all of the Hawaiian Islands, as well as a clinic in Guam, American Samoa, and the North Marianas. So we have a presence throughout all the Pacific. And not only do we just have a clinical presence, but we're also able to provide telemedicine. And in addition to that, we have a number of specialty care providers that we fondly refer to as circuit riders that ride the circuit from island to island to be able to provide specialty services to our veterans. So if you haven't signed up, please come see our booth. We'd love to provide care to you. We're very proud of the staff that we have on board. In fact, about 25% of our staff are veterans themselves. Any VA Pacific Islands healthcare staff in the audience? Woo! Really, really proud. We've grown our staff over the past 2 years. We've increased our overall FTE to about 1,400, about a net increase of 200 individuals to provide care, much needed care to veterans here in the Pacific, and we are very dedicated to that. I want to highlight some of the accomplishments and some of the services that we're now providing, because I'm really proud to be the director of the system, and it's really an honor for me to share with you all the good information. I want to share with you that during the Super Typhoon U2 out in Saipan, I want to let you know that VA Pacific Islands, our telehealth staff, were called upon under a FEMA task order to serve the people of Tinian to provide telemental health services as they were going through that very difficult time. I'm also very proud to say that over 1% of our veterans are now being seen from the comfort of their home, and we're expanding those services. We have veterans that can call a telephone advice nurse and be able to provide services. We also have the only VA all-virtual pain team in the nation. We also are working on increasing our HUD-VASH vouchers to help home our homeless. The homeless task force that we have in partnership with the community is tremendous. We have a coordinated entry system where we and the community are all working together to ensure that we're tracking our veterans that are going through the system. We've had very successful job fairs. So if you are a veteran or interested in working for the VA, again, we're hiring. So please come see our booth. We love to hire veterans. We also have very successful services. We've done a lot to improve our access to care. We've established what we call intermittent providers. We have additional teams that we've added. We've expanded clinical pharmacy. We also have our own, we're the only station we've funded a Veterans Mentor Coordinator position. This is very important for the Veterans Treatment Court in keeping our veterans out of the jails. We're also very proud that we're rolling out customer service programs called Own the Moment, where we're focused on ease, effectiveness, and emotion of every interaction that we are having with our veterans, because it's so important that we continue to service. I'm getting the hint that I need to...
No. I just wanting you maybe to explain Own the Moment a little bit more. How is that being implemented and where?
Certainly. So Secretary Wilkie's #1 priority is customer service, and I'm a firm believer that if I have happy employees, I'm going to have happy patients, and it's really a training that really helps us focus on every interaction that we have an opportunity to connect with veterans and make it the best experience, because we want veterans to choose VA for their care, and we value opportunities and forums like this. It gives me a chance to hear what's working well and maybe what's not working so well that we need to continue to work on.
Right. Well, the theme was salute to service and fulfilling the promise. It sounds like you're implementing that already in your establishment.
Absolutely.
Super.
Well, I'll just wrap up, and I know I can't help myself. I'm just so excited about all the good things that are being done.
You see the list of notes she had handwritten. She's really into this.
I'm just again really proud of our staff, and I know that from a private sector standpoint, they're comparing VAs now to the private sector and commercial, and they are now having some of how we're doing with our outpatient metrics in terms of prevention of medicine. And if you look, you'll see that VA Healthcare Pacific Islands is often doing better than the community. Not to say that we don't appreciate our community partners, but we are trying very, very hard to do the very best that we can. And we appreciate our partners, Triple Army Medical Center, Guam Navy Health Center, and in our partnerships and sharing agreements, we all work very closely together to provide services. So thank you.
Wonderful. Thank you so much, ma'am. And to bring in a couple other folks, I am a trained psychologist, and when you mentioned benefits and when you mentioned TRICARE, TriWest, I saw a couple of folks there squirming in their seats, dilated pupils, change in breathing and heart rate. So, Andrea, you've already got the mic, please.
Aloha. Andrea, as we said before, and thank you, Jennifer, for all those wonderful updates. So does VBA, right? So a few things I just wanted to mention. The Appeals Modernization Act, which went into effect officially in February, and wanted to make sure that you know that VBA is very, very committed in moving along those appeals and making sure that they are being done in expeditiously and quality fashion for all those appeals that have been out there for many, many years. And yes, it's with a plural. I'm sorry, ma'am. But it is very, it's a problem, and we know it, and we've been really trying to move that along, VBA and the Board of Veterans Affairs. So it's the board and VBA. So anyone want more information? I know we have somebody in the exhibit hall, and I also have a fine coach here from the office, Eric, and he will be happy. Yay, Eric. It takes a team and one ohana, right? So that's the Appeals Modernization Act. The Blue Water Navy, Procopio versus the United States, and Congress has said that we are now expanding the Blue Water Navy veterans, mostly sailors that have been in that area, so area outside of the whole Vietnam area and Micronesia there, to extend benefits 12 nautical miles. So that's been a big court and benefits that Congress has been working on to really try and expand that. So anybody in that category, please make sure you inquire to see if you are eligible for benefits that surely will be of benefit to you. Character of discharge, I always want to mention. So lots of work, the Board of Veterans, VBA, in working on CODs and making potential service members eligible to be able to have benefits depending on their categorization for their misconduct. So lots of information on that, and I know that it's an important subject a lot of times for Vietnam, post-Vietnam era, and making sure that we take care of those people that might have been having mentally, psychologically times, and making sure that they were not discharged in an unfair process with the new mental health information that we know about now. So that's pretty important to my heart. Jennifer mentioned the Hello booklet, and I thank you to our colleague here who brought it up to us. I think it's a great resource to understand where, who, what, where, VHA, VBA, and NCA, National Cemetery, all fall under VA, and it's one VA. But a lot of times people are really confused on who to go to for what, and what phone numbers are allocated. So if I'm in the healthcare system, does that mean the benefit side or the cemetery side know potentially who I am? Not necessarily, so we are really, really working on that. We learned in the last couple of weeks the 360 vet, where VHA and VBA are going to start sharing demographic or phone numbers and addresses, so I think that's a great endeavor, because yes, we are under one administration, but our computer systems have some time to, some areas to improve on. So we're working on that, but please make sure that all of your addresses are correct in all of the facets and the silos, so to say, so we don't miss you. Don't have benefit information going to a wrong address. I know Jennifer talks about physical address versus the residence, so all of that is important that you keep on top of that, especially if you're moving or in the mainland at times. The other national call center, 1-800-827-1000. They've done lots and lots of work on making sure that we have appropriate staff, staffed up on that, and wait times are down. And although you might not get all of the information that you might be looking for, and you might have to call directly to a regional office or come into one of our public contact areas, lots of good information to start with. So national call center. And in addition, the e-benefits is another popular platform to look up information on, and you all should have an account if you're a veteran and seeing what information is out there. It's not as detailed as many people say that they would like, but it's a good starting point, so I recommend that. And of course, as Jennifer, we too are hiring, especially on the outlying islands and here, so anybody interested, please always check USA Jobs for that. So I think that's it, and I will hand it off to you. Thank you.
Hi again. I'm Jim Horton, the director up at Punch Bowl Cemetery. These guys usually get done and everybody goes, I don't want to talk to that guy. That's not a good thing to talk about. You need to talk to us. You should talk to us. As Andrea said, there's kind of a blurred line between the benefits of burial within the VA, but that doesn't matter. You guys get hold of us, we'll get you to the right place to make sure you understand who to talk to get those benefits. Surprisingly, within the U.S., only 10% of eligible veterans take advantage of the burial benefits that the VA guarantees. So if you have any doubt about whether or not you are eligible, the very best thing to do is to go next door to our table back here on the other side. There's a form there, it's called Pre-Need Eligibility. What it'll do is you'll send it in, and in the essence of good federal government, it will literally take about a year right now is the wait time to get the results back. But they will let you know as a veteran, and more importantly for your family, so that they know whether or not you're eligible for interment, not only in a national cemetery like Punch Bowl, but in one of the 8 state cemeteries here on the islands that we have. So it goes across the board. It does not guarantee that you can be interred at Punch Bowl or one of those cemeteries. It allows you the knowledge you are eligible for a cemetery, if that makes sense. So, the other thing to grab while you're over there at the table is a booklet, since hello, welcome to the VA. The secondary booklet is Planning Your Legacy. And it's a collaborative book between the VBA and NCA. And ma'am, thank you very much for showing that off right there in the middle in the blue. So really nice, colorful book. It looks like it's thick, but the good news is there's about half of it is forms and places for you to fill out data. And again, veterans, this is not about you. This is about your family. It's co-locating all of the information that your family needs in your transition. Sorry, we're all going to go there one of these days. We can't stop that. But it will help them know where things are, DD 214, your will, your insurance. It puts all of that information in a single place so that your family can more readily work through what is already a very stressful time in your life. Okay, so beyond that, know that the NCA Punch Bowl, if you guys have any questions, please stop by or give us a call, and we will either help you or redirect you if any questions or concerns are about state cemeteries. Like I said, there's 8 out there. Ron Hahn, who I'm not sure how he wound up not getting stuck on this panel, he's the state cemetery or state Veterans Affairs Director. He has been doing this a while. He is very, very smart, and he is on top of all 8 of the cemeteries. There are projects ongoing constantly, so understand that he can help with areas even if we can't, especially if it involves Hawaii state issues. And then the last thing to talk about is a lot of good work going on that maybe some of you have seen in the news over time, and it's continuing, and there's a secondary benefit for all of us in this audience as veterans, and that is the disinterment work of the unknowns that are at Punch Bowl. Combination of World War II and Korea. The focus right now is on Korea. We started a few years ago with 850 plus. We're down to about 570, and of those, almost 120 have been identified now, which is awesome for those families to have that closure. But the secondary benefit it has for us here in Hawaii is it takes what was or is a closed cemetery at Punch Bowl for casket interments and makes it available. So we wind up with those casket sites back, and those casket sites now become available for local veterans to use. So all I would ask is, if at that time of need, call and ask if that's what your interest is. Understand also that the state cemetery over in Kaneohe has got room for decades, literally, so there's no issue over there. But your options for burial out there within the VA are cremation, casket. Even if a lot of people do cremation and then scatter at sea or scatter other places, there's also memorial marker options. So you've got a lot of options available. More than 10% of us should be taking advantage of that, as opposed to paying the very, very high price for commercial interment. So again, let us know if you got any questions at the end or otherwise, and that's it. Thanks.
Well, that's a hard act to follow. But thank you. My name is Carl Kyokawa, the Pacific Regional Director at Tri-West Healthcare Alliance. I'm very honored to be here, to have the opportunity not just to speak with all of you, but to sit alongside the VA leadership here in Hawaii and the Pacific. It is truly an honor, so thank you. There are a couple of things I wanted to start with, and then we have a table over in the exhibit hall, and these are the 2 most popular questions that were asked this morning. The first one is, oh, you guys are TRICARE. I have a TRICARE question for you. We're not TRICARE, we're Tri-West. The TRICARE program is the Department of Defense health plan that's administered by a company called HealthNet here in Hawaii. But we'll try to answer some of those questions if we can. The second one is, I heard the choice program went away. So what are you guys going to do now when you close down? It's like, well, no, Tri-West is still here even though the choice program went away. So we all have gone through a big change, as Jennifer has summarized, with the VA Mission Act implementation on 6 June, and the choice program going away, now having community care program. Tri-West is still here. The nice thing is we continue to have the opportunity to work in partnership with the veteran VA Pacific Island Healthcare System team. If some of you in the room were or are government contractors or contractors working with government partners, you all know how important it is to have great partners on the government side. I can't say enough about the VA Pacific Island Healthcare System team. It's a one-team effort to support veterans throughout the Pacific. If it wasn't like that, life would be rather difficult, actually. But we have a great partnership. So the choice program goes away. Jennifer already mentioned that veterans in Hawaii and the Pacific, prior to June 6, could call TriWest and get an appointment with a community provider. Starting on June 6, that phone call needs to initiate with the VA. And I agree with that, even though on TriWest, people think, well, TriWest, your guys are losing business. No, we have enough work to do. I think it's a good thing that the VA is the starting point for a veteran's health care. The VA knows the veteran, all of you, the best. When the VA is unable to provide that care, for whatever reason it may be, we are here to then facilitate that appointment to a community provider. That is what our partnership is about, to support the VA, to support the veterans, to make sure as a total healthcare system in Hawaii and the Pacific that we are here for you and taking care of you. So that's how that construct is working 6 June going forward. Are there bumps in the road? Absolutely. This is a huge national change that we're going through. So we're working together with the VA Pacific Island Healthcare System, with veteran support organizations, with all of you to work through all of these bumps in the road. We want your feedback. So at the TriWest table on the other side, if you do have a situation you'd like to share with us, as I always tell veterans, I want to know the good, but more importantly, I want to know the bad and the ugly. Because it's the bad and the ugly that provides us the opportunity to improve the process. So your feedback is very important. The other thing we do, in addition to appointing and facilitating the scheduling of care in the community, is to make sure that community provider is there to support you. So our responsibility is to establish a network of providers throughout Hawaii and the Pacific to make sure they're educated, they're supported, we're taking care of their claims and billing issues so that they continue providing that important care for all veterans in Hawaii and the Pacific. Part of that network is now the building of the urgent care clinic network that Jennifer mentioned. We are in the process of doing that, fast and furious. The way to find out who's in the network is if you go to va.gov and follow the instructions on how to get to the urgent care clinic listing. You'll find that there's a sparse number of urgent care clinics on the list today. On Oahu, we have all of the CVS, as we know here in Hawaii, Long's Drug Store, the Minute Clinics, they're all on the list. And when you get out to the neighbor islands, it's still a little spotty. But a lot of the paperwork and the agreements and the activity that's going on is what I call, it's in flight. So hopefully you'll see providers start populating that list as the days and the weeks go on. And it's our commitment to you to continue growing that list so that you have access to this important new benefit called urgent care. So I'm going to kind of stop there and just want to wrap it up by saying it is, again, an honor to speak before you, but again, to sit next to this esteemed panel of VA leadership in Hawaii and the Pacific.
What I would like to do is open up, use this portion to open up some questions. But first, let me set some parameters here. This is not a place to air grievances or to get into bickering or telling horror stories. This is not a place to litigate your disability. And when Carlos Santana gives you a microphone, it's not an invitation to sing. Okay? So, you just had an opportunity to hear from 4 wonderful experts. Please, I'm sure you all have some questions. If you just raise your hand up, we've got some microphones, and we've got a young gentleman here, Mr. Chaos.
I have a question real quick for Carl while I'm coming over here. So, with the calls being directed primarily to the VA, and this is going to sound like an Affordable Care Act, if I like my doctor that I have now, do I need to change my doctor? If I'm already having a community care doctor, is it going to go back to the VA before I can get to see that doctor again? Or maybe it's for Jennifer then.
It's okay, we'll jointly answer these questions. So if I understand correctly, the question is if I have a community care physician I'm seeing now and I like seeing that physician, I can continue seeing that physician. The answer is likely yes. Carl will comment about all the great work that they've done behind the scenes to transition from physicians or care providers being quote unquote choice providers to being under the new arrangement that we have. And so that should be pretty seamless. So yes, is basically the answer on that. Carl, do you want to comment a little bit?
The reason why I wanted to start with Jennifer is, again, in this new construct of care in the community or community care, the VA is taking the lead in all of this, and we're here to support. But to just kind of expound upon Jennifer's comment, A lot of the providers that were participating with the Choice program, even though the Choice program has ended, we've transitioned many of them over into the community care program. So continuity of care should not be an issue. If you are speaking with the VA and you're already receiving care from a community provider and you'd like to continue that care, please let the VA know. Their staff, both the administrative and clinical staff, are very in tune with the importance of continuity of care.
Thank you. We have a question for the healthcare side.
Hi, good afternoon. My name is Leonardo Morel. I'm a combat veteran. The question is in regards of SGB injections, the stellate ganglion block injections. Some VAs in the mainland, they're providing this service, and it's a breakthrough in the treatment of PTSD. When the VA here in Hawaii is planning to offer these services, most of the veterans do not even know about SGB injections in the treatment of PTSD.
Let me start by saying thank you for your service and thank you for bringing that forward. My knowledge about that, we've requested to have that be part of the package to be able to provide. Right now, unfortunately, central office has told me that that is not considered part of the benefits package, that we can provide that service. I'd be happy to get you some more information about that offline, but essentially, we're not able to provide that service currently as part of the package for services. But I have heard how beneficial it is, and it's something that we put together a position paper a couple of months ago requesting the consideration for that, but it did not get the movement at this point because I think they're looking at more evidence-based information coming out about it at the central office level. But I'd like to connect with you afterwards and get your contact information. The more that I can share going forward about that this is something that is needed, I'd like to do that. Thank you. And I'll just mention that afterwards I'm going to be available. I'm happy to meet also and with one-on-one with anyone to address any questions or concerns or things that they want to bring forward. Thank you.
Okay, thank you. Our next question is for benefits.
Since the Congress has passed, and I guess the President will be signing the Blue Water Navy question, as an Air Force guy, I just want to know, does that include 12 miles above the area in Vietnam or not? I have individuals who flew in airplanes, O2s, remember the O2s? Yeah. And those airplanes actually sucked in air from all sorts of things. So these individuals are wondering, are they now also included in that 12-mile designation if they come down with one of those presumptive conditions? Thank you.
Very good question. I think you got me on that one. So I don't know I know 12 nautical miles, and that is the definition that Congress gave us, and I don't know if that means up. So I will, Eric, do you know?
There's no clarity on that.
Yeah, I see Eric taking notes. Let us try and clarify on that, and let's connect afterwards, or with Eric, your name and number, and it's probably many people have that question, so thank you.
Kaz, way to represent the Air Force and throw a wrench in things.
Go Navy.
Blue water, not blue air.
Thank you.
Over here, to your left.
Who do we have?
Back in the left corner.
No, I'm hearing voices, that's not, oh, there we go. As long as your voices compliment you, it's okay.
This is another question for benefits and related to education.
Hi, the VA has just come out with a pilot program called VTech, Veterans Employment Through Technology Education Courses. And it's an additional 9 months off your post 9/11 GI Bill, but the providers are nowhere near Hawaii. I was wondering if there was going to be some push for the colleges to provide that opportunity to the veterans of Hawaii.
Thank you. So to not make it more complicated, there is a section under VBA, which is education, which of course has a different silo. We actually in the regional offices have the Voc Rehab and Employment Services, so that's chapter 31 and 36. and GI Bill is Chapter 33. And I do not have a lot of information about that program, but I will take it down and we'll make sure we get your contact as well to make sure that we can get you that information. You're welcome.
Very good. Carlos, do you have another?
This is another one for benefits.
Hi, my name is Clay Park. I'm kind of wondering that the application for benefits, you usually have to go online now to fill up that application. There's a lot of veterans in the park that doesn't have a computer. So does the hard copy application still exist?
Sure, thank you. You can come into our public contact area anytime and we can assist you with the application in paper or not. What we will do though is immediately scan the paper up to our scanning center and then they will start the process and it will go electronic from there. So of course, I mean, we all don't have computer access, we all don't have printers, but we are always available at the regional office to help with that and appeals, and we can help print off documents or do it electronically online with you. But very good question, thank you. And of course, Jennifer reminded me that we will post all the questions and answers online, so for those that do have computers and want to look at the answers or get them out to other people, we'll make sure we have that as well.
Anyone want to bring Jim back into the conversation and with our Ohana here? Anything for Punchbowl? He's a nice guy. And he's Air Force.
I believe he talked about the pre-need eligibility, correct?
Yeah.
You did? I did. The year-long wait is because veterans are finding out about this program.
Yes.
I did this maybe a year and a half ago and got my response in about 6 months. So if you haven't, I don't have a question, you can put the microphone down. I'm just saying, it's a great program, and if you haven't done it, do it and make that wait and get it done. Well, we do have a question for community care, so I guess it would start with Jennifer and then maybe end up with Carl. But if you do have questions for Jim Horton and Punchbowl, let me know. Come on.
Hi, my name's Cindy and I'm a nurse case manager actually in the DoD, but I've worked closely with the VA with some mutual patients. And I'm still just not having a very good understanding of the referral process to get someone seen that the VA does not have the service for with the new community care program, like the referral process and what to expect. And is there one point of contact for that, or where is that office located? Can I physically walk there to check on something? Can you speak to that, please? Thank you.
Yes, thank you. Great question. So what I understand you asking is how do you find out about the referral process and where things are? Right now, you can contact the VA through our call center. I can give you that number. It's 1-800-214-1306. And right now you press option 2, option 5, and then option 1. We're working on getting a direct line, but right now it's part of the phone tree. That'll connect you with our care and the community staff. And we have experts that are manning the lines for answering any questions about the referrals or the process. So it can absolutely start by calling the VA, and we can walk you through the process from there. And that they're located, we have folks that are located at the ambulatory care center. We have a patient advocate that's also available for any questions. So we do have resources, but again, that call center is probably a great place to start by contacting the VA. Certainly, I'll mention, I'm sure if Carl's came into TriWest and Carl, they'll also do their very best to answer the questions and do any warm handoffs to our staff. Thank you.
Thank you. Carlos.
We have a question for Punchbowl.
You mentioned that not only could you have a coffin burial, but a cremation, but then if you didn't want any of those, there was something like a plaque?
Yes.
So what's the plaque all about?
So, and I didn't even talk about markers outside of the state or veteran cemetery also. So the memorial wall is essentially if you went and looked at a columbarium where there would be an urn inside or behind the marker, we actually have a memorial wall where it is just a bronze marker, so there are no remains there, but it is a place, it is essentially a touchstone for families to go and pay respects and be able to spend some time thinking about their loved one. And it can be, it's not just for the veteran, it's a spouse as well, so it's for both. And in fact, if the veteran is interred somewhere else, the spouse passes away, you don't have to have both there. The veteran doesn't have to be there first. The spouse counts just as much as the veteran, so either way. And the one thing I forgot to mention in the ramblings earlier is if you do decide to inter and have your final resting place not in a state or veteran cemetery, through VBA, through the benefit side, you are still eligible for a marker. And even if you don't want the marker that's going to be provided by the government, you can do a medallion that dignifies or otherwise signifies your service as well. So there's quite a few options out there. And between VBA and NCA, we can steer you there. Okay? Thanks. Great question.
I think that's it, so we can probably wrap up and then announce 145 as the next breakout. And between now and 145, we have time for you guys to visit the exhibitors and vendors.
Good stuff. Thank you all.
Thank you.